Hello, today we're going to talk about ethical considerations for nurses. My name is Crystal Sosh. I've been a nurse for 17 years, and today I'm going to be acting in the teacher role. Before we begin to consider ethical considerations of nurses, there are some terms that you'll need to know. The first term that you'd want to know is values. Values are attitudes, ideals, or beliefs of a person or group that guide their behavior. Morals are rules of conduct to determine right from wrong when a decision is to be made. Ethics are used to reflect actions a person should take. These can be codified into an ethical code of a profession. Bioethics are the application of ethical theories and principles to moral issues or problems in healthcare. Another term used for bioethics is biomedical ethics. A moral dilemma. A moral dilemma is a conflict in which one must choose between two or more actions and have moral reasons for choosing the action. The purpose of this presentation is to provide you with an understanding of fundamental ethical considerations for the modern nurse. Included in my presentation is a history of the ethical and moral reasoning processes that are used in the nursing profession. In later portions of this presentation, my teammates will be applying this knowledge to the ethical dilemmas that arise with technology. Now we're going to talk about Kohlberg's stages of moral reasoning. This was a theory that was created by Lawrence Kohlberg. His model of moral development explains how a person learns to handle moral dilemmas from childhood into adulthood. His approach to moral reasoning proposes 3 levels of moral reasoning as a function of cognitive development. Kohlberg's stages are pre-conventional, conventional, and post-conventional. In the pre-conventional phase, the person is unconcerned with social norms. They are self-centered, and their wants or needs matter more to them than right or wrong. These people respond to punishment and reward systems. This group includes young children, some adolescents, and also adult criminals. In the conventional stage, Kohlberg proposes that the decisions are based on the expectations of families, groups, or society. People in the conventional phase seek to please others and eventually to please society. These people respond well to the law. Most adolescents and adults function at this level. In the post-conventional phase, the person is more independent thinking. They have more clearly defined self-awareness of their own moral values. They're not concerned with self-interest, and they're not concerned with group norms. They will sacrifice themselves for the good of the group. This is the highest level of moral reasoning, and very few people actually reach this level. Carol Gilligan was a theorist who in 1982 felt that Kohlberg focused too much on the masculine perspective of moral reasoning, so she decided to focus on the feminine perspective. She felt that in women's lifespans they focused more on care, whereas men focus more on justice. She proposed that women's growth in moral reasoning occurred in a 3-stage sequence as well. The first stage of Gilligan's theory was that of orientation to individual survival. The second stage was the focus on goodness with a recognition of self-sacrifice. And the third phase was the morality of caring for yourself and others. Another focus that we need to take to understand ethical considerations of nursing are some ethical theories. The first ethical theory that we're going to discuss is deontology. In the theory of deontology, morality is based on the intention, not the outcome. And one must do their duty and fulfill their obligations to be moral. So if a person means well, then they are moral. One of the early and most well-known deontologists was Immanuel Kant. The next ethical theory that comes into play is utilitarianism. Utilitarianism says that morality is determined solely by the outcome, and it pushes people to do the greatest good for the greatest number of people. Some theorists that contributed to this theory were David Hume, Jeremy Bentham, and the father of modern utilitarianism, John Stuart Mill. The next ethical theory to consider is virtue ethics. In virtue ethics, people are believed to have tendencies to act, feel, and judge through training with natural tendencies. This means that we are born with a moral virtue. More recently, bioethics literature focuses on the innate character of a person being the thing that pushes them toward a moral choice. Another ethical theory that is very important to nurses is principlism. In principlism, ethical principles are used to analyze and act on ethical dilemmas. Some of the principles that are considered often in healthcare are beneficence, which is to do good, non-maleficence, which is to do no harm, autonomy, which is a respect for others' rights to act in their own best self-interest, fidelity, which is faithfulness, veracity, which is telling the truth, and justice. In justice, equals are treated equally and unequals are treated differently. Now this can sound a bit confusing, so when you think of justice, think of a patient coming into the emergency department. If you have two patients that come in with the flu, it doesn't really matter. There's nothing else that matters about those people that is going to make you get one of them back there faster if they have the same symptoms. But if someone comes in with chest pain, they're going to be brought right back. The person with the chest pain would be the unequal in that situation. In nursing, it's important that we have a code of ethics, and most major professions have codes of ethics. A code of ethics is a social contract between a profession and society stating the foundational principles and rules. A code of ethics will allow for self-regulation of a profession. It can serve as guidelines in care, and it must be known and upheld by the professionals to be any good. In nursing, we have been known to have some manner of a code of ethics since 1893. The Nightingale Pledge dates back to 1893, and it was the first public evidence of an ethical code in nursing. In 1896, the Nurses Associated alumni of the United States and Canada, which would later become the American Nurses Association, or the ANA, came together to create and maintain a code of ethics. Although it was formed in 1896, it took a lot of years before a code of ethics was formally adopted. So finally in 1950, the 1940 Code of Ethics was adopted. It was revised in 2001, and became known as the Code of Ethics for Nurses with Interpretive Statements, and it was last updated in 2004. Another code of ethics that it's important to know about as a nurse is the International Council of Nurses Code of Ethics for Nurses. The International Council of Nurses published the Code of Ethics in 1953. The ICN Code of Ethics relates rights and responsibilities of nurses to people, practice, society, co-workers, and to the profession of nursing. The last revision of this Code of Ethics was in 2005. This Code of Ethics is an agreement by more than 80 national nursing associations. Part of the preamble of the ICN Code of Ethics is a statement that says that nurses respect life, dignity, and the rights of all people, mindless of nationality, race, creed, color, age, sex, political affiliation, or social status. You can view the ICN Code of Ethics for Nurses online at the link on your screen. Also, at that same website, you can view other information about the International Council of Nurses, and I encourage you to do so. There's a lot of interesting information on there. According to the International Council of Nurses, a nurse's responsibilities are to promote health, prevent illness, restore health, and alleviate suffering. Something else that we have to consider when we're thinking about ethical considerations of nursing are how the nursing process relates to the ethical decision-making model. So in the nursing process, the phase of assessing would cover clarifying the ethical dilemma and gathering additional data. Analyzing would be the point in the ethical decision-making model where you are looking at your options. Planning in the nursing process would be the same as making a decision in the ethical decision-making model. Implementing is the same as acting, and both phases end with an evaluation. There are several types of ethical dilemmas that we encounter as nurses. Some of the types that we might encounter are dilemmas that result from things like our own personal value systems, the behavior of other nurses or healthcare workers, sociocultural influences, dilemmas related to a patient's rights, immigration and migration, institutional and social issues, and finally, dilemmas related to patient data access. Now, you can see that I've put asterisks besides those because my teammates will later discuss more in depth some of the ethical dilemmas that come about as a result of technology and accessing data. So we discussed an ethical dilemma earlier, but I found a definition on nursetogether.com that I thought explained it well. What is an ethical dilemma? An ethical dilemma is a problem without a satisfactory resolution. The significance of ethical decision-making lays in the fact that very different ethical choices regarding the same ethical dilemma can be made, resulting in neither choice being a right or wrong decision. Ethical dilemmas create stress for the nurse. And there was a study that was conducted by Ulrich, Taylor, Sakin, O'Donnell, Farrar, Danis, and Grady. And in this study, they surveyed 1,000 nurses and asked them about the ethical and patient care issues that cause stress for those nurses. The majority of the respondents reported that they frequently or daily encountered issues related to things like protecting patients' rights, informed consent to treatment procedures, advanced care planning, difficult staffing patterns, and surrogate decision making. Also, end-of-life issues were a source of stress that related to ethical considerations for nurses. On this page, I've listed the sources that I used, but also there are many links that you can follow to get more information about nursing ethics. I hope you've enjoyed my portion of my team's presentation, and I hope you have a great day.